maybe next 3 months goes by. We just camp with we can't take any donations. We can only get sponsors for this camp only.
So we are from Caring Souls team and we are conducting a blood donation camp today in Moira Club, and this is for a good cause because we want to save a life from this donating camp, and we expect a lot of people to come and give their blood to save someone else's life, and it is actually good for a person's body also, because people, like a girl should donate in 4 months and a boy should donate in every 3 months, so that in every 2 days, like after you donate a blood, and within 2 days your body automatically pumps out the blood so it is replaced, so fresh blood pumps in. So it's better you donate blood in every 3 months or 4 months for a girl and all, so to save a life. Thank you.
What is your scene? How long you have?
The camp and all. So this is my second camp which I'm there. First it was organized in Porvorim Sukur, so I was a volunteer there, and that was also my first time of donating blood there. And I was having a fear before, but after that camp I think my fear is gone of donating, the getting scared of the needles or donating blood. All my questions and worries are gone. So yes, this is feeling better, and my second camp, so I hope it goes successful.
Okay, hi, my name is Talula Di Costa, and I'm here at Moira Club to donate blood for the third time. So I've been donating blood ever since my uncle had requirement of blood, so from then I've been a continuous donor. They say it's important, like blood can really save somebody's life, so I voluntarily come here and I donate blood. It feels good, a little pinch, but then it feels nice to donate the blood.
So what were your fears and anxiety in the mind?
There was no fear as such, only I used like the needle, but then it's just a slight prick and that's it. And also if you do not have your proper breakfast and come, then it could be a problem. So you have to be full, fed well, drink a lot of water and come and donate your blood.
Okay, myself Sanket Parastekar from Caring Souls. So till date we have organized more than 16 blood camps overall in Goa. Caring Souls is basically more into blood donation camps. We are also into beach cleanliness drive and few orphanages visits we have done. And we aim to organize these blood donation camps so that blood banks don't face the scarcity of blood. And we also try to get new blood donors, so wherein they will donate blood and help us in keeping the blood banks replenished.
Now today, what was the result?
So this camp, our team leader from MAPSA, Ranjit, has done a fabulous job, and they have done it with the help collaboration with Kalji Group. And I appreciate the efforts they have put in for this camp, and I'm hoping for a good turnout this time because they have put in efforts. And pre-registration, I think they had almost got 42 numbers. So considering that, I think we'll have a good number this time. Thank you.
माझे नाव शुभम सुंदर गावडे, हांव शिरोड्याचो महाराष्ट्रा. हांव ब्लड डोनेट करपाक गेला दुसऱ्यांका कोणाक गरज पडता ताका लागून सगळ्यांनी डोनेट करा. म्हाका बरें दिसलें डोनेट करून. हांवें फर्स्ट टायम डोनेट केलें.
Good morning. I am Dr. Claire De Mello, Medical Officer at the Blood Bank of Goa Medical College. We are here for a blood donation camp this morning, organized by the Caring Souls. Somewhere we had come here in the month of March too, and there was a very good response. We got around 50. We are expecting a good response today too. Now many people say, why do we need to donate blood? We can donate when blood is needed by my relative, by my patient. But till today, blood is not produced in machines. One has to donate blood to save a life. Your every unit that you donate, we take it to the Goa Medical College Blood Bank, and we have a component separation unit. Your one unit is divided into 4 components: packed cells, fresh frozen plasma, platelet concentrate, and cryoprecipitate. So your one donation is saving 3 to 4 lives at a time. Now how much is one person donating? Just 350 ml. Who can donate blood? Are people between the age of 18 and 65, first time donors till 60. We check your hemoglobin, it has to be more than 12.5. Your weight should be more than 45 kg. So a 45 kg person has around approximately 4 liters of blood in his body. He is donating only 350 ml, makes no difference to his body. This entire volume gets back into his body in 1 to 2 days. We advise all our donors before donation to have a very good breakfast, a heavy breakfast. Like as they're donating this morning, a heavy meal before donation, and within 3 to 4 hours of a meal, they should donate blood. Good night's sleep is very important. If you have any health issues, we ask them to be very frank with us, be honest with us, because under certain conditions, there are a certain deferral period. Like we ask them if you have had any accidents, operations, malaria, jaundice, and many more, allergies. So you have to be frank with us. Even if you have pressure problems or diabetes, people can donate. There are certain deferral things that we ask you. So be very honest with your health history, and it is kept confidential by blood bank. Now, men and women both can donate blood. The criteria is the same, but women who are nursing their babies or who are pregnant should not be donating for a year. They can donate only a year after their delivery, a year after they stop their nursing. So the criteria is the same for men and women. And once you donate blood, donation as such takes only 3 minutes. We ask you, after you fill your form, your hemoglobin is checked, you go through a medical checkup kind of. Your unit of blood is for sure tested, mandatorily tested by blood bank before issue for 5 diseases, that is HIV, hepatitis B, hepatitis C, malaria and syphilis. If anything comes abnormal and you have ticked on your enrollment form, I would like to know of any abnormal test, you're called and retested, counseled in blood bank. But if you have ticked a no, of course we discard it if it comes abnormal, but you are not being called. So you are given a choice to know of any abnormal test. So you go through a kind of a medical checkup. It's good, and studies have also shown that people who donate regularly from a young age and regularly donate, it's good for the heart. There are less chances of pressure problems and heart attacks later in life. Now, a man can donate once in 3 months. Woman, the time interval for donation is 4 months. She can donate once every 4 months. We don't expect people to donate maybe every 3 or 4 months. You can. There are many donors who do so. But at least make it a point to donate once a year as a social responsibility. It's a great blessing because you do not know where your blood is going, to whom, which patient you are helping. Because there are many, like we have patients who are thalassemics, who require blood maybe every month, every 15 days. They cannot get so much replacements. They do not. We don't take replacements from them. So your blood goes for such cases, cancer cases, kidney disease cases requiring multiple transfusions. So your blood goes to someone whom you don't even know. So it's a great blessing. We welcome everybody. Come forward, donate blood. After donation, we make you sit for 10 minutes. Donation as such takes only 3 minutes. It's a small ant bite like prick. 3 minutes, the 350 ml is out, and then we ask you to keep your arm loosely up, sit for 10 minutes, have a very good, we give you some refreshment, and you can go forward with all your normal activities for the day. We advise you no smoking and alcohol for the next 6 hours, no strenuous exercise on the day of donation, and if you're riding or driving, you can do so after half an hour of donation. So welcome everybody, come forward, decide a particular day, maybe it's your birth anniversary or your parents' anniversary, donate once a year at least twice a year. If you're passing by and there's a blood donation camp, you're feeling fine on that particular day, you have crossed your time interval of donation, enter it and donate blood. Now we give you a card after donation. This card is an incentive where you can use this card anytime in your life once in exchange for any one component. When you come to blood bank and say you have to replace blood for your relative or someone needs blood, of course we never refuse blood. For every emergency, blood is released first. Replacements may come in later, but you can surrender that card as a replacement. Provided we have that blood group for what you have come to us, we should have it in stock. We accept the card. Our card is accepted by other government blood banks of Goa too, like Hospicio and North Goa and South Goa District Hospital cards are accepted by us, and they accept our cards. I welcome you all. Come forward and donate blood. Thank you so much.